Hi, I'm Dr. Katie Simmons, and I am a pelvic floor physical therapist, as well as the owner of ATL Pelvic Health. We are a specialty pelvic health practice located here in Atlanta, Georgia, and we have pregnancy and postpartum specific programs to help support women throughout each trimester of their pregnancy, making sure that they feel empowered and prepared for their birth, as well as following them postpartum to help with postpartum healing and address any symptoms like urinary leakage, painful sex, or bowel issues. Today, I wanted to talk to you a little bit about perineal massage. This is something that we introduced during our birth prep program, which is part of the pregnancy program. We initiate this during somebody's third trimester. Usually we start somewhere in the 30 to 34 week range, and this can be really helpful to kind of help prepare the superficial pelvic floor muscles to stretch to allow space for the baby during your vaginal birth. So if you're not familiar with your pelvic floor, here is your pelvis. You have this right and left side pelvic bone. They're joined in the front at the pubic bone here and the back at the tailbone and sacrum. Your pelvic floor muscles are forming like a sling or a hammock, running from your pubic bone in the front, wrapping all the way around to your tailbone in the back. During a vaginal birth, there's this common misconception that your pelvic floor muscles are involved with pushing your baby out, when in reality, these pelvic floor muscles need to stretch and get out of the way to make space for the baby to descend through the vaginal canal. And so what that means is the space between our pubic bone and our tailbone is the space that we have to make sure that the baby is able to get out successfully. When we think about perineal massage, we're thinking about stretching and preparing this first layer of muscles to move and get out of the way for that vaginal birth. And so I like to think about your vagina or your vulva, which we're looking at externally like a clock. Up towards your clitoris is 12 o'clock, down towards your anus is going to be 6 o'clock. When we're doing perineal massage, I like to really think about focusing on stretching this bottom half of the clock. During a vaginal birth, women can experience tearing in a variety of directions. So you can have some perineal trauma up towards the urethra or towards the clitoris. More commonly, women are going to experience tearing down through this perineal body area. I like to think of the perineal body as grand central station. So it's the space here where several of your pelvic floor muscles are all joining together. And this tissue here needs to stretch almost 200 times its normal length to get out of the way, coming all the way down towards that tailbone to again make room for the baby's head, shoulders as the baby is descending through the vaginal canal. Now, research on perineal massage basically tells us that there's nothing that we can do to prevent tearing. However, we also know that there's no harm in doing perineal massage. There's no guarantee that you won't have tearing if you do this, but I'm of the mindset if we can prepare these muscles to stretch, we can help to eliminate and reduce any kind of perineal trauma that may occur to that tissue. So there's a couple of different ways to do perineal massage. Again, we're focusing on the superficial layer. So these muscles right around the opening of the vagina. So I like to think from 3 o'clock over to 9 o'clock is the area that we're primarily focusing on when we are stretching. You can have your partner involved helping do this. You can do it on yourself using a thumb. I'll show you a couple of different options there. There's also an option to use a pelvic wand. Some of our patients really like to use this because it gives them a little bit more freedom of movement as you are progressing throughout your pregnancy. It might be harder to reach around your belly to get down to your perineal area to do this stretching. And then some people's partners are maybe not comfortable with it, or they have different schedules, and it just gives the birthing person the autonomy to do the perineal massage whenever they have time. And so that wand is a really nice tool that is something we can use during pregnancy and also postpartum. So if you're doing it to yourself, you can use a thumb. If a partner is doing it to you, you can use an index finger. If you're not in the shower when doing this, you want to use a little bit of lubricant. In the office, we use something called slippery stuff. It is a water-based lubricant. You don't need a lot. We just don't like to insert a dry finger into the vaginal canal. With perineal massage, this is a very superficial technique. So I find that a lot of people stick their fingers and they go all the way into the vagina. you really are only going about a nail or a first knuckle deep into the vaginal canal to stretch these superficial tissues. There's not any damage if you go further. You're just most likely skipping over the area that we're wanting to focus on. So when you begin, again, if somebody's doing it to you, they would insert their index finger just right into the opening of the vagina. And then I like to gently just pull down towards the 6 o'clock position. If I'm doing it and showing somebody on a hand, it looks like this. You're inserting the finger into the opening of the vagina, and then you're just lightly pressing down towards 6 o'clock. And you're just noting if there's any tension or tenderness there. And then you can start to move your finger around the clock. So maybe going to 7 o'clock, 8 o'clock, over to 9 o'clock. Holding in each section for about 30 to 90 seconds. If there's any excess tension, you might want to spend more time in that area versus other areas where maybe there's a little bit less tension. And then you can come to the other side, so going from your 6 over to your 5 o'clock, and then your 4 o'clock, and making your way around. A couple of other things that you can do is what's called a sweeping technique. So you can go from 3 o'clock over to 9 o'clock. You want this to feel like a stretch. So there might be a little discomfort. There might be a little bit of a stretch happening to that tissue, but it shouldn't be painful. I always say if you put your fingers into your mouth and you pulled your lips apart as hard as you could, and you kind of get that like tingly stretching sensation, that might be what you feel when somebody's doing perineal massage to you, or when you're doing it to yourself. But we want to be mindful of any pain. I always caution that partners can sometimes be heavy-handed, and so giving them some feedback, they tend to go too deep, and then they also will sometimes go a little bit too aggressive or heavy with their hand as they're doing this stretch. So if you're having your partner help you with this, which I think this is a great way to get partners involved, especially towards the end of pregnancy, but you just want to be mindful of what you're sensing in your body. If it's feeling painful, give them a little bit of feedback. They can just reduce how much pressure they're applying to that muscle and tissue. And then again, over time, as the tissue starts to soften and release tension, you may be able to apply a little bit more pressure. And so similarly, if you were doing this to yourself, you would insert your thumb into the vagina and then you would work your way around that clock. For women during pregnancy, one thing I like to recommend, if you're in the shower doing this, the water is enough of a lubricant. You don't need any excess lube. If you have a stool or a bench you can prop a leg on, you can really open up that tissue and create space. And then even with a pregnant belly, you may be able to reach around and still find a thumb is able to find the opening of your vagina to do that stretching from this angle. Some women also like to lie on their side in bed and do this. Ultimately, we want you to be in a relaxed, comfortable position. So oftentimes if a partner is doing this with you, we'll just recommend that you're laying in bed with your knees opened up and supported. And so maybe placing some pillows underneath those knees and being in a really relaxed position. The last thing I'm going to show you is if you wanted to do this with a pelvic wand. So here's the pelvic wand. I like to think of the wand as just an extension of our hands or our fingers. Really, for a wand that's in this shape, you can use either end. This more narrow end allows you to get deeper into the pelvic floor muscles to release some tension in those deeper layers of muscles. For the sake of perineal massage that we're doing today, you can really use this end that has the tapered edge on it. You place just a little bit of lube right on the tip of the wand. You don't need much. And then same thing, you're going to insert the wand. I like to hold it in this direction, so the opposite end is pointing up towards the ceiling, and you're just going to insert the tip of the wand right at the opening of the vagina. Again, you're going about this far deep into the vaginal canal, so really not far at all. And then you're just going to gently stretch that tissue. So you're going to gently pull down on the wand towards that 6 o'clock position. Then you might rotate the wand over towards your 7 o'clock, 8 o'clock, 9 o'clock. And then you can come back to 6 and then go in the other direction, working over to 3. Similarly with the finger, you can, when you're stretching the tissue, you can just pull and hold, maybe doing some deep breathing, trying to focus on relaxing as these muscles start to stretch and lengthen. You can also gently sweep the wand from one side to the other. Again, the goal here is just to prepare this area for stretch that's needed during a vaginal birth. That is all I have for you as far as perineal massage goes. If you have any questions, please feel free to reach out. You can follow along with more tips and tricks at ATL Pelvic Health on Instagram. Please like and subscribe to our YouTube channel. We're going to be trying to upload some more useful videos here as well. And then if you have any questions about becoming a patient or looking for other resources in your area, you can also reach out to us at www.atlpelvichealth.com.